What does the Ca-19-9 blood test mean for pancreatic cancer? Imagine a blood test that can give clues about pancreatic health, but not a definitive answer on its own. That's where the Ca-19-9 blood test comes into play. It measures a protein called cancer antigen 19-9, which can be found in the blood. This protein is often higher in people with certain cancers, especially pancreatic cancer, which makes it a useful marker in some cases. But it's important to understand that Ca-19-9 is not a perfect test. It can be elevated in other conditions too, such as cancers of the bile duct, colon, stomach, or gallbladder. Non-cancerous issues like inflammation or blockages in the liver, gallbladder, or pancreas can also cause higher levels. The normal range for Ca-19-9 in healthy people is usually between 0 and 37 units per milliliter. If your levels are above this, it might suggest something is going on, but it doesn't automatically mean you have pancreatic cancer. Many people with elevated Ca-19-9 do not have cancer, and some with pancreatic cancer may have normal levels. Because of this, the test isn't used to screen the general population for pancreatic cancer. Large studies have shown that screening people without symptoms using Ca-19-9 isn't effective because it can miss many cases and lead to unnecessary worry and testing. Instead, doctors typically use the Ca-19-9 test when someone already has symptoms or risk factors for pancreatic cancer. It can help guide the next steps in diagnosis. Once a diagnosis of pancreatic cancer is confirmed through imaging and biopsy, Ca-19-9 can be useful for monitoring the disease. If the levels were high before treatment, doctors can track changes over time. A decreasing Ca-19-9 level might suggest the treatment is working, while an increasing level could indicate the cancer is progressing or returning. However, it's crucial to remember that Ca-19-9 is only one part of the bigger picture. Diagnosing and managing pancreatic cancer involves a combination of medical history, physical exams, imaging tests like CORT or MRI scans, and sometimes tissue biopsies. No single blood test can definitively confirm or rule out pancreatic cancer. From a pancreas health perspective, the Ca-19-9 blood test is a helpful tool mainly for monitoring known disease and guiding treatment decisions. But it should never be used alone to diagnose or exclude cancer. Always consult a healthcare professional who can interpret the results in the context of your overall health, symptoms, and other tests. If you or someone you know has concerns about pancreatic cancer, seeking medical advice is essential. Proper testing and expert guidance ensure the most accurate diagnosis and the best possible care based on current medical standards.